one of the key problems at the moment in global health is that we're trying to do partnerships like two-legged stools. And as we know, two-legged stools actually don't work. We work that out. But that's what we have, because countries are moving away, as in donor countries, are moving away from country presence in and around Africa. And we depend on mega funds like the Global Fund and Gavi to come in without country presence and have a partnership, these global health partnerships on the ground. But there isn't actually that support, the third leg of the stool, on the ground to help with coordination, to help with logistics, to help with networking, to have basic conversations with those that are in charge in those countries to allow for that sort of support. But we do have that here in this program, because we have a three-legged stool. And there are formal relationships. For example, Irish Aid and Mozambique have had a partnership over 20 years. Ruud de Burke was talking about that previously. There's a statement of intent between Mozambique and the HSE, and there's a memorandum of understanding between the HSE and Irish Aid. So this is a very strong partnership. It's a three-legged stool that is about improving quality. So quality improvement. Technical support is provided by ESTHER, essentially, through the HSE. The logistical and funding support is given by Irish Aid, with the embassy on the ground that's highly active in coordinating with the Ministry of Health, who's leading and prioritizing the program. That's key. So the platform is Mozambique-owned. And that, of course, has its own challenges. In terms of the transfer of skills, the expertise available, as I said, through ESTHER, but there's two-way actual learning here as well. As in, those that are providing the training are highly active in terms of thinking about the training and learning from how they're given that training, and actually bringing that learning back and providing changed training for quality improvement in Ireland in the modules that this particular ISCAP trainer is providing. And that's him there, Peter Lackman, highly engaged in the program. Here's Lorraine Murphy, who will be presenting later. I can see her here. So part of the model is you go there, you provide the training, and then when you come back to Ireland, you support through Zoom, for example, or Skype, and that then keeps the support going. Enthusiasm is absolutely key as part of this, and the Mozambicans are enthusiastic because quality improvement is a new paradigm in quality. Rather than being policed against KPIs and performance-based financing, sort of audits of quality assurance, this is a model of quality improvement, which are simple models, but there are models of planning, doing, evaluating, and then reacting, and so quick cycles of monitoring and quality improvement. Another key thing is implementers meeting with implementers. There's a convergence of minds here. People who want to improve stuff at the coalface. That's absolutely key. I don't know whether the Global Fund really has that. I don't know whether Gav really has that. But when it comes to actual implementers understanding quality improvement, going there and working with other implementers, convergence of minds, coming together of minds over this particular interest of quality improvement. The other thing is, it's a bit of a dream because we have the national level and the local level all working together. So we're bridging this gap that is so often happens in development. That is a huge gap between the legislators, the policymakers, and actual service providers. They're all working together in this particular program. The other thing is there's a blank slate. Quality is a relatively new thing, so it's been all about access. And quality improvement is even more of a new thing, because it's all been about quality assurance and audit before. Quality improvement doesn't actually require much money, so therefore you're not being audited against something that's essentially impossible, because you never get the money to actually reach your KPIs normally to meet the quality assurance benchmarks. But in quality improvement, you work with what you work with. There are simple tools, so it's a bit of a quality improvement worker's dream, actually, the situation there. As I said, it lends itself to the country setting because there's no coercive sort of policing against demands set against KPIs in order to get funding. Very strong leadership in Mozambique. That's key for this model. They have institutionalized new structures, national structures, as a Directorate of Quality Improvement, and it's part of quality is part of their strategic plans. Results, I won't go through them, but lots of results, lots of hospitals. Limitations. Of course, there are limitations, and the key limitation are the usual limitations in a developing country setting. Chronic staff shortages, lack of appropriate supplies and equipment, and you sort of patients, we get it in Ireland as well, patients being dumped by families, and you're sort of stuck with that situation. Various social issues. Challenges, obviously three-legged stool. If one of those legs breaks or becomes weak, then you're left with a two-legged stool and the thing falls over. Now we've seen that a little bit in terms of one of the legs. There were some issues in Mozambique at the embassy level, which meant a certain weakness. So that's one challenge. Personality-driven. I think we all know, working in developing countries, that actual personalities play a huge part. So, and this is, at this early stage, certainly very much personality-driven, with the director and the deputy director having strong personalities, but what happens next? Some confusion around ownership and attribution, particularly with the technical assistance provided, as in it's easy to try and get the attribution for success and for the program your own, but this is about Mozambique, not about us. Language, not a challenge. Bizarrely, Portuguese is what they speak in Mozambique. This was not a problem. And why? Because of Google Translate. It was amazing how much that could help, but also in terms of very good logistics and translation and so on provided by the embassy. WhatsApp has been fantastic in terms of communication in this partnership. Zoom has been a huge part as well in terms of the follow-up and support. But I think the key thing is, at this particular juncture, this is critical. We need to consolidate the results and the improvements made, and that's partly why I'm looking at this. I'm doing an evaluation of the program, and the recommendations of that then will be key in driving this program forward and making it sustainable.